Hey everyone, I'm your host Anthony. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Hello everyone and welcome to our live class. We're so excited to have you here today and we're looking forward to a great lecture. My name is Anthony and I'll be your host for today. I'm joined on the line by Stewart, CEO and co-founder of MindBody Talent, who will be conducting most of the presentation today. I'm going to pass it off to her momentarily to kick off today's topic, which is titled Top Trends in Healthcare, 5 Talent Strategies for Winning Big. So I think we're all really excited about this one, and I'm sure we're going to be learning a lot. So I'd like to go over just a couple housekeeping items before we begin. First of all, I've muted everyone by default. And number 2, if you have any questions during the course of this live class, please submit them into the chat panel. The questions will come to me as the host, and I will be conducting a live question and answer with Robin at the end of today's presentation. So with that being said, I'd like to welcome Robin Stewart to begin today's presentation. So thank you, Robin.
Anthony, thanks so much for inviting us and to the entire Rupa team, Tara, Kobe. Really appreciate all the work that you're doing to help practices and certainly this partnership. So first of all, for those of you that don't know MindBody Talent or haven't heard of us yet, we are a full service national recruitment firm that serves the functional and integrative medicine practices across the country. So before I get into my presentation today, I wanted to just tell a little bit about how I found my way into functional medicine and then with this recruitment company, because I'm asked that question a lot. So I'm going to start with talking a little bit about my journey. So I've been in the recruitment business for about 25 years in various capacities. And I found my way into functional medicine probably similar to many of you. I had an untreated autoimmune disorder that brought me to one doctor after another and another and another. And after about my 5th prescription, I was in seeing my doctor, and he was convinced that it was all in my head. So this time he wanted to write a prescription for an antidepressant because my labs were normal. Everything was fine. Does that sound familiar? And told me that, there really wasn't anything else that he could do. So coincidentally, I had actually been working for a third-party recruitment firm, and I had gotten my first search for a functional medicine doctor. Well, interestingly enough, I didn't know anything about functional medicine, but the more that I learned from this candidate that we ultimately ended up recruiting, as well as more about the needs of the practice, I learned and recognized that, wow, this could help me. And when I started to see what I saw, I couldn't unsee that anymore. And so when I had the opportunity, after I met my business partner and COO, Rich Hoffman, and we launched MindBody Talent, I looked at this as really an extension of ourselves and those kinds of things that were important to us. So, I had always looked at my relationships and the communities that I built around those relationships as being, kind of like an inch wide and a mile deep. And when we looked at MindBody Talent and what that was going to do and what we both had discovered about functional medicine, it really gave us the opportunity to serve the needs of practices in this very niche vertical, again, that was an inch wide and a mile deep. We didn't want to be another healthcare recruitment company that served multiple areas and multiple lines and really spoke to lots and lots and lots of different areas to recruit. We really wanted to be super specialized and in this niche market. So the market responded. We have been extremely blessed and have been able to work with a lot of great practices across the country. So, in transition and into coming into this now and working with all these practices, we've learned a few things along the way and hoping to share some of those nuggets with you today. Okay, so coincidentally, I just got off an amazing call with a candidate just a few minutes ago, and every day I'm reminded why I love recruiting. And as I think about all the aspects that go into recruiting, whether that's a search that we're working on or a search that you're doing, a lot of these things that are coming into the strategy around staffing are things that, certainly that we're thinking about. But our goal is always to look at providing better patient care. And obviously with better patient care comes better profits. So for just a few minutes, I want you to kind of take a stroll with me in this infographic, starting in the middle, in the inside of the circle. So as we approach, and as you're approaching staffing and considerations for adding team members, thinking about where you are now on this journey. So, what health and wellness conditions does your practice currently address? Where do you want to be? Where is that going now and at whatever point in the future? So for example, is Lyme disease something that you see that perhaps is something that you really want to be able to focus and help your patients on, but can't because you don't have somebody in your office that has the expertise? Is that something that long-term, that would be a consideration? We look at the different therapy modalities that you currently offer and ones that you might want to have later on. I'm thinking about what is the crux of the core of the types of patients that you're currently working with and that you're currently serving. Are they primarily there for hormone balancing? Are they there for type 2 diabetes or hypothyroidism, other autoimmune disorders? So as I'm thinking about the strategy, I'm also thinking about, as you should be thinking about, all of these other components that are currently in your practice. What kind of continuity of care protocols do you have? Do you have everybody kind of doing the same thing, or people, having different approaches to it? I'm looking at the different practice revenue streams that you have, the different payment modalities. Are you currently offering telehealth? Is that something you want to do in the future? And last but not least, the culture of the practice. And the culture of the practice is probably the most important as I think about how we approach recruitment from a strategic standpoint, and as a practice owner, ways that you should be looking at your culture as well. So I'm going to talk about a story, a placement that we made. It was like early 2020. And it was for a practice in the Southeast. And it was a very successful functional medicine practice that was really growing and doing great work. The problem was that they had a practitioner that was highly toxic to their staff. From the minute this practitioner walked through the door, it was venom and toxic from the moment she walked in to when she left. And it really did affect everybody in the practice. So when we met this provider, he was considering making her a partner in the practice because she was very good with patients and she was very good at her work. The problem was that it brought the entire office down. So what we were able to do was help him think about this in terms of where this was going to be going, what he wanted to do. So that provider was moved on, and then consequently over the course of 9 months, we recruited her replacement, but then subsequently an additional 2 practitioners. So I guess the exciting part of the story was that having just had a chance to revisit some of that with them, have told us how we've completely transformed their practice. And that was really by mainly focusing on what was happening internally in the culture. So again, as you're thinking about the strategy of recruitment, it's not just bringing on a practitioner, thinking about all of these things inside that circle. So as I'm thinking about these things, I'm hearing all of the stuff on the outside of the circle. I'm hearing about the growing distrust of conventional medicine. Turn on the news or, open up any social media stream and it's right there front and center. There is additional engagement and increased awareness by patients that are looking at being their own healthcare advocates, and they're looking for answers and coming to functional and integrative medicine for all those reasons that we just spoke about: COVID-19, the pandemic, has certainly leveled the playing field for sure with conventional medicine doctors and functional medicine doctors being able to really kind of now, meet at this place, because there's no magic pill. Yes, there's a vaccine, but is it effective? Is it not effective? And how does it work? And there's lots of questions that people have around that. So there's a lot of noise out there about that as well. The insurance industry is being awakened by this. And they are starting to take notice. So we're hearing a lot about that too, and how these practice models are evolving. So functional and integrative medicine is clearly gaining some steam. And I talk to people that are non-medical people that have heard of functional medicine. And even 5 years ago, it was nothing I had ever heard about. So I know it's been around a lot longer than that, but certainly people are really starting to pay attention and are more hyper aware of it than ever before. So kind of in summary, if we want to think about this for a second, so staffing your practice really does involve every aspect of not only what it is now, but what it will be in the future. So today I want to talk about these 5 trends and strategies that we're seeing every day as they play out in our recruitment efforts. The first one being, staffing for the right range of patient needs, serving your patients, and creating those additional revenue streams that practices are looking for. The second one, we want to look at your best in-person or remote patient care and kind of finding that right balance of talent and services. Then thirdly, we're going to look at integrating health coaches into practices and kind of how to make this adopt from the mindset of how do we make this a revenue generator instead of an expense drain, that some practices look at this right now. Number 4, never compromising on that unique culture and hiring to that culture, really investing in a process to be able to attract talent. And then 5th, looking at resources that really help you gain efficiencies and higher practice profits that are going to deliver the best in class patient care. Okay, so as we look at the entire patient journey, right? So our goal is that we have these strategic discussions with our clients to try to help them figure out, ways to grow smarter. So if we're talking about a practice that is looking to grow, that's a very different conversation from somebody who's just looking to hire talent, right? So a lot of patients that practices have worked with, they've been sick for a long time. The practices of these doctors have got them covered. They evaluate them, they diagnose, they put together a care plan. And as the patients start to feel better, they start to look better. And as they start to look better, they want to be better. So in a lot of different ways, practices are also looking at how can they, diversify their revenue streams. What are additional things that they can be doing and offering patients to be able to expand upon their current offerings, as well as being able to, increase better patient care and increase more revenue for themselves. There are, back to that, feel better, look better, be better. It does involve a lot of different pieces. So I'll just start front and center with medical aesthetics. That really is an area that continues to grow and expand in a lot of practices. One particular practice that we have helped and worked with in the past, she started a small medical aesthetics practice. Within the first month, she saw a 17% increase in revenue, in top line revenue in that practice. And now 18 months later, that whole practice of her med spa has contributed to 35% of her total revenue. So that really has been great. It's allowed her to monetize other areas in her practice that, she has obviously a nurse practitioner in her that's running and managing that for her. But, it does bring in additional revenue for her and doesn't cost her any time. We have another practice that we worked with that we're watching certain patients going to other practices because she just simply didn't have an IV infusion therapy offering for her patients. So with some conversations about, bringing in a director that could really, blow this up and create something amazing for her, with a refresh and some build out. She was able to construct some existing space that she had into 6 infusion suites, and offers everything from Myers cocktail to chelation therapy and ketamine treatments. So it has really been able to, create additional offerings and more revenue for her practice, as well as, again, elevated better care for her patients. As we're moving into the be better part, right? So there's a lot of high performing athletes that want to move into peak performance, and are they doing that with some regenerative medicine? Are they doing it with different exercise therapies that are out there now that are really exciting? So we're seeing a lot of these practices trying to get involved with other service lines to be able to reach that be better place that patients ultimately want to end up. One of the other areas that we really are seeing a big uptick in is in pediatrics. Practices recognize that kids are not just little immature adults with small bodies. They have different needs. Their liver function is different than ours. Their metabolism is very different. So having a pediatric functional medicine doctor in there, having a functional medicine nurse practitioner in the office to add to that, obviously brings in a different patient panel. Or different patient base. They're bringing in their parents, and maybe the parents have never been patients before. And as they're there, they're starting to explore other areas and modalities that they hadn't really thought about before. So as practices start thinking about some of these additional service lines, there are some things to consider when you're looking at that. So, obviously, first thing, know your demographics, your patient demographics. Is there enough treatment demand to see a return on your investment? Understanding what those revenue goals are weighted against that, the cost of that device, right? Or the salary of the talent. And as you look at the capabilities that you currently have, if you want to add medical aesthetics the next, several years, but you need a nurse practitioner right now, does it make sense to find a nurse practitioner that has some medical aesthetics background now or regenerative medicine background now? So those are some of the skills that obviously you're recruiting for, not only today, but with an eye on the future. So in summary, the additional services typically can equate to greater patient care and loyalty, and then obviously that care and greater practice revenue down the road as you add some of these additional modalities. Okay, so talking a little bit about in-person and remote care, what kind of things work best. People are getting more and more accustomed to membership and subscription models, obviously thanks to Netflix and Costco and your local gym. There is a set delivery amount, right? And a care schedule that's predictable, that the doctor can predict for revenue, the patient can predict for how frequently they're going to be seeing their doctor. So there is some truth to kind of why that membership model works so well. And lots of practices that we work with obviously are already there doing that. The pandemic has, brought about how that patient care is acquired and delivered, and many practices have already opted into, adding telehealth or considering adding it at some point in the future. The big question is it here to stay? So there are obviously theories and opinions about that on both sides of the spectrum. There certainly are some medical practices that have built their whole model on telehealth. Blue Cross and Blue Shield of Tennessee, I just read this recently, they have stated in their policy that telehealth visits will now be 100% reimbursed now and in the future. So they're adopting it, and they feel it's the way healthcare is going to be delivered now and in the future. JD Power just had a survey that speaks to the other side of it, and they feel that it's falling into the same old rut, and that the pendulum is going to start swinging back to the middle again. And I'll share some of those statistics with you in that from that study from J.D. Power, and it's online if you want to go look at it later. But telehealth adoption spikes across all generations in 2021. And overall, 36% of patients have accessed telehealth services during the past year, which makes a lot of sense because of the pandemic, which was up just 9% from 2020 and then 7% in 2019. They cite convenience, ability to receive the care quickly, and safety as being some of the biggest reasons why they accessed it. So patient satisfaction, though, has declined as some of these pain points have started to emerge, and that would be both in direct to consumer and payer sponsored care. So that has declined from 2021 to 2020. And the most frequent barriers encountered by patients are limited services at 24%. So basically what they're saying is that, telehealth is great for a certain reason why somebody is going to go and talk to their doctor. But if they're coming in if they need or want medical aesthetics, they've gotten to that point where they want to look better, you can't exactly receive medical aesthetics through a Zoom lens. So that obviously limits their ability to service their patients that way. So in summary, practices are going to need to decide if the investment of this meets the needs of the practice, kind of in concert with the driving demands of the patients. So truth, I don't have an easy answer for that. Okay, integrating health coaches into your existing practice. So let's just for a minute consider the tremendous value that comes with adding a health coach and viewing this from a place of being a profit center, not an expense drain, as I mentioned earlier. And health coaches are playing a really important role in filling in kind of the gaps in the practice. So obviously, they're great motivators. A health coach should be somebody that engenders confidence. They're somebody that evokes a sense of spirit. They're happy at their core. They are cheerleaders. They want people to succeed. And when a patient comes into care with their doctor is, even though they're functional medicine, they're limited in the bandwidth of what kind of expertise they have to be able to get them to that place. And then also the time and the focus that the doctor has with being able to deliver that level of care at that point. The health coaches have been trained, for those that have gone through the program with behavioral change therapy. Not all of them can do it, but that is an area and an application that certainly health coaches can help with. And they partner with the doctor to translate the plan of care into a plan of action. So they really are there to support these changes. Patients are interested in participating in their own rescue, but they need the support to be able to do that sometimes, and support with behavior modification, with food choices, with movement, and the supplement choices, and why they should be buying them from the supplement store from their doctor instead of at their local discount pharmacy. They need help with sleep and mindfulness. So all of these components are things that health coaches can really add value into the practice. We had a conversation just yesterday with a very wonderful woman who is very well entrenched in the health coaching world. And she shared that there's some data that shows that health coaches actually can increase supplement sales in practices. There's data behind that, because the health coaches can help the patients understand the value of that, whereas maybe the doctor just suggested ordering these supplements, but the patient doesn't really have the biggest understanding about why they should get it from them and at that particular brand versus somewhere else at their discount pharmacy. So they certainly can add value on that side of it as well. Health coaches have generally, at least the ones that we've talked to and interviewed, they've made this journey themselves. A lot of them have overcome tremendous health challenges, whether that is, obesity themselves, or whether that is an autoimmune chronic illness, whether that is mental health. It runs the full gamut. So they are extremely credible and have walked the walk and have been on that journey. So when we look at finding the right health coach in your practice, there's a lot of, programs out there, a lot of, become a health coach in a weekend and, 6-month program, whatever. But you really, if you're looking at adding a health coach into your practice, really find one that has gone through a rigorous training program that's highly regarded. And one of the main reasons is that you want to ensure that your health coach stays within their scope of practice, that they understand that they are not physicians and they cannot be giving medical advice, right? So in some of these other programs that are extremely rigorous and, highly regarded, they are drilling that home, that they stay in their lane and that they stay specialized. It keeps the practice safe, it keeps the practitioners safe, and obviously it keeps your patients safe because they're not getting the wrong advice. Definitely look for a health coach that either is certified by the National Board of Health and Wellness Coaches, or they're on their way to certification. That really should be their headliner goal, right? That should be the end of the line for, where they have reached the status in their health coach journey certification. And it should be something that as a practice that you would be looking for as well. It does obviously bring a lot of credibility to that health coach as well as the practice. I had an amazing conversation earlier last week with Elise Wagner from the Functional Medicine Coaching Academy. And, obviously they have a wonderful strategic relationship with the Institute for Functional Medicine and are the gold standard of health coaching programs. Elise was so fired up, and her enthusiasm translated into my enthusiasm. And, every day just about I get off the phone or off a Zoom meeting and think that, we've got the best job on the planet. We connect these amazing talent with these amazing practices. And, to be able to be a part of that, to be the matchmakers is really, really special and something that we obviously treasure and are grateful for every day. But Elise was so fired up about this. She said, she not only wants to have a health coach at every clinical practice in America, but she wants health coaches in universities, mental health offices. She wants to see them in schools, in prisons, in corporate wellness programs and spas. Anywhere there's anything health related, she wants a health coach there. And you know what? I think that there's value to that because of all those things that we talked about earlier on that piece of accountability and helping that plan of care to turn into a plan of action. So that's really exciting. And I was looking at her website the other day and pulled some statistics off there, and that 24 million Americans have been diagnosed with an autoimmune disorder, and 2 billion people are overweight. 41 million of them are children. Here's a staggering statistic. 86% of our healthcare costs are related to lifestyle-driven chronic disease. So when you think about that in terms of where our healthcare system is going, and that comes back to lifestyle choices that we make, boy, there's a lot of work to be done, and there is a huge need for health coaches in the work that they do. So to summarize, I want to, as we look at adding a health coach to your practice, they're moving the patients from feeling better to looking better to being better. And that be better part translates again to better patient care, more loyalty, and better profits for your practice. So staffing to your culture, we talked a little bit about this earlier. When you're approaching your staffing needs, whether you're doing it yourself or having a firm like us do it for you, our job is to make sure that we find the talent that fits, that succeeds, and stays. Those are the goals. And in looking at that culture, I want to know the mission. I want to know the vision and the values of that practice. And you should know those too. Know your mission, your vision, and your values, and make sure everybody on your practice knows it too. So I want to talk about mission for a minute, your mission statement. Every business, practice, agency, whatever you have should have a mission statement. And that mission statement should never change. Your mission statement should be the same today as it will be in 30 years. It defines who you are and why you do it. Your values, know your values, and that helps you create your mission statement. Those tenets, those core beliefs of who you are as a provider, who you are as a practice, ties into that mission. And again, that mission doesn't change. Your vision will change because your practice will evolve, different staff will come in, you'll add different modalities, you may end up completely in adding something you never thought. So your vision will change, but again, it always ties back to the mission and who you are. And when you're looking at recruiting to that culture, what makes your practice so special? And in this world of things being so homogenized, don't be afraid to talk about what makes your practice special. Know who you are and be able to sell it, and hire to that culture without compromise. It's so critically important when you think about that in terms of the value that comes into that. Excuse me. Talk about investing in a recruitment process that creates that wow experience for the best talent. Starting with a job description. Okay, so I mentioned earlier that I've been in the recruitment space for about 25 years, and I am guilty. I have written my fair share of really bad job descriptions. Some I could even swear about, but nonetheless, I've had my share of bad job descriptions, but I've gotten a little bit better at it, and I'm clear about now what gets people's attention. And what gets people's attention is you have to stop them from scrolling. You know, we all scroll, we've got our phones, we scroll. You got to stop that. And the job descriptions have to be provocative. They have to get attention. They cannot read like a peer-reviewed clinical study. Your job description has to be exciting. They have to be able to see themselves in that position. They have to see themselves living in the community, working in your practice, and being able to just really evoke those emotions that they feel from that job description in translating in what is that job going to be like. And that speaks to your brand identity, how you've been able to put that out there. You know, recruiting is not just about brains and strategy, it's about heart. And the heart of the candidate experience is really where kind of the rubber meets the road and where all the good stuff lives. And it can prove to be invaluable when you are kind of evoking that emotion in the right candidate and how that speaks to your brand. So branding is important, sourcing is important, and that digital sourcing strategy that's right above that, you know, that helps find passive candidates. And, you know, although advertising on a job board or on, you know, some of the social media platforms, that's all important, and it is still part of our strategy. But having a digital sourcing strategy to be able to find those passive candidates, somebody that would say, hey, I'm not in an active job search, but that sounds really interesting. Tell me more. I should have looked this up, but I don't have a firm statistic, but I would venture to guess, as I quickly kind of go through the recruitment that we've done this year, I would say that probably 60 to 70% of the candidates that we've placed in new jobs were not in active career searches. So you have to be able to find them and, you know, evoke that emotion in them enough to get them off to want to have a conversation with you about this. So that's a really important part of it. And obviously, you know, leveraging your time to be able to, you know, work with a recruitment firm that's all we do, and finding that kind of talent that's in a very specific market. So to summarize, like I have been in every other slide, I like to compare this to an old saying my grandmother used to say. She'd always say, Robin, measure twice and cut once. Make sure that as we look at measuring twice and cutting once here, you invest in a process. And whatever that process is, stick to it and make it a process. Don't have it just be a one and done. So we'll talk about some of these other systems that that we see and we have available to us. Right here, I just want to plant some additional seeds in your mind right now. So we encounter lots and lots of amazing systems and technology that support practices, and sometimes we can kind of run down a rabbit hole, and because it's exciting and it's new, and we really do have some expertise in trying to vet out some of the stuff that makes sense and what doesn't make sense. But certainly reach out to us as a resource. If we don't have something at our fingertips, and chances are we can probably find something that does. So certainly any of these other resources that you may come across and don't know about, we probably have seen it or heard about it. So happy to share what we know and impart that on you. There are several resources that obviously can make your practices a lot more efficient and make that practice experience a lot more seamless than you might have right now. And a few of them are, if you haven't considered it or are looking at it, but some of these additional extra specialty labs that obviously bring a deeper level of understanding in patient care, whether that's metabolic testing or genetic testing or hormonal testing. And obviously Rupa Health can help with all of that lab testing, but that is another revenue generator, and it's relatively low cost or no cost for the practitioner. It also, on the education and learning, it does bring support and learning for the practitioner, and obviously more credibility. And as the practice is getting that information out through social media channels, again, it adds more credibility to your practitioners. It also promotes and educates patients on what these additional services are. So that's another great low cost, high return piece that you can look at in a practice. And then anything that's going to generate additional revenue, like the EMR system. A couple of years ago, we learned about Power to Practice, and Power to Practice, it was developed exclusively for functional medicine practices. So you're not taking an old conventional medicine EMR system and kind of jamming it into a functional medicine visit where the practitioner is spending a whole bunch of time trying to figure out what the translation would be to make this work. So, so those are important as you're looking at ways to streamline the practitioner experience. Looking at some resources, I'll talk about FullScript and WholeScript, primarily because we use them. Our doctor has a store on both of them, and it's super easy for us when we run out, just run there and fill it up. And obviously we know we're getting great supplements, and it does. And I know that our doctor gets some revenue from that, and he's a great guy, and I'm happy that's where it's going and not with our local discount store or Costco, or not that there's anything wrong with Costco. I love Costco. And then lab testing with Rupa. So Rupa, if you haven't heard of Rupa, come on, get on it. Go to their website right now, tell them MindBody Talent sent you, and figure out how easy this is to streamline that lab testing and follow up for your patients, to be able to bring that in a way, in a delivery model that is seamless and transitions beautifully into their patient care. So we're always looking to find ways to add value, to add systems for low cost or no cost to increase your patient care and increase the practice profits. So just additional resources. Thank you so much for your time today and allowing us to share some of these trends that we're seeing and how we're attacking them, and being able to look to MindBody Talent as a resource. If you are a job seeker, a candidate that is looking for an opportunity, and last year I wrote an article on how to maximize your job search experience, reach out to me at Robin at MindBody Talent. I'd be happy to share that piece with you. And then if you're a clinic or a practice owner, and you want to have the 5 ways to maximize your talent search experience, certainly happy to share that with you as well. I think that's it. I will take any questions anybody has. Hopefully I have an answer. Usually I'm never short on that.
Thank you so much, Robin. That was truly amazing. I think this information really is important for so many practitioners in the functional and integrative medicine spaces. So thanks for diving deeper into this topic today. So we did get some questions during the presentation, and I'm going to try to get to all those now if that works. All right.
Okay. All right.
All right. So let's start with the first one. The first one we have is, how long does a search for a candidate typically take?
Okay. Okay. Well, first of all, there's no typical search. I'm going to give you, remember when you were in math class, you have the high and the low, and then you cut it out and you get the median. So typically searches can take anywhere between, if we're being realistic, it can take anywhere between, 90 days on the fastest, and then, 9 months to 12 months on the high end. So it's got to be somewhere in the middle, and managing those expectations about what that looks like is, something to consider. So, I had a call this morning with a potential client who wants to put a provider in early spring. So she said, when should we start looking? And I said, well, generally, 3 months would be the fastest, but a lot of doctors have, 90, 180 days, 6 months out in their contract. So you have to be really cognizant of that.
Very interesting. I know if you want quality talent, sometimes it takes a little bit longer to find that quality talent. So That's a very interesting point. Okay, second question, Robin, is functional and integrative medicine the only type of searches that you do at MindBody Talent?
Happily, I am able to say yes. As I mentioned in the very first minute of talking, we are an inch wide and a mile deep, and that's where we want to stay. We just want to be servicing and serving the needs of functional and integrative medicine practices, MD, DOs, mid-level providers, health coaches, some of the other staff. We certainly have done that as well, but only in that lane, keeping it an inch wide and a mile deep. We don't want to be all things to all people.
Makes sense. Makes sense. Thank you for that answer. All right, Robin, number 3 question is, do you see functional medicine and integrative medicine becoming more mainstream over the next few years?
Yes, I do. I'm already seeing it. And every chance my partner Rich and I get to talk about it, we do. And we do that in a respectful way, of course, but certainly the trends are all showing. And as I mentioned earlier, the conversations that we have with people that are not in this space that understand it more, we see more and more practices opening. We see more and more people, joining on a membership basis. People are really starting to take notice. And as I mentioned also earlier, COVID-19 has really brought that into the forefront of people's minds.
Good to know. Very important. Thank you for that. All right, Robin, we have one last question here for today. And with your background, what do you think is the most ideal team structure for success? We know you went over a couple different of those structures today. So what would be the most ideal team structure in your background?
So, I'll echo what I talked about with the health coach. And one of the great advantages that we have, and Rich says this beautifully all the time, is that we have such a very different perspective than most practices have and most practitioners have, or candidates, because we can see the forest for the trees. We see all different perspectives. So I don't have any reason to promote health coaches for any reason other than I think they add tremendous value and can really bring additional revenue into practices. And I talked about the reasons why and how. So if we're talking about an ideal team, in my opinion, would be, in my experience, would be a provider. So that could be a doctor, a nurse practitioner, a PA, and a health coach working in concert with ultimately providing the best care for patients. as well as the other ancillary staff that's needed to run a clinic. So if you have additional therapy modalities, obviously you have to have people that can provide those services, but definitely a doctor, health coach, or mid-level, and a health coach.
Makes sense. That's really, really fascinating. Thank you for that, Robin.
Yeah, of course.
So
thank you for the great questions.
Yes, thank you again for answering all those. And I know we weren't able to get to everyone's question today, but please reach out to us after the live class if you still have any additional questions. So again, thank you for attending today's live class. I want to give a huge shout out to Robin, Stewart, and MindBody Talent. This was truly interesting. I think really helpful for all different practitioners out there. So again, thank you again, and we hope to see you at the next live class.
Thanks again, Anthony. Bye.
Thanks.